everybody. Today we'll be discussing the ketogenic diet and how it can help patients overcome obesity. So the keto diet is a high-fat, low-carb diet. And when an individual decides to follow the ketogenic diet, what happens is their body then utilizes the fat and the protein as an alternate source of energy rather than relying completely on glucose. The keto diet prevents overconsumption of carbohydrates, which leads to the storage of glucose in the muscle and liver. Carbohydrates hold on to water. So when somebody is following the keto diet, their initial weight loss is typically water weight from not consuming so many carbohydrates. When glucose is in short supply, the body undergoes a process known as gluconeogenesis. During gluconeogenesis, the liver produces ketone bodies, which are used as fuel for cardiac muscle, skeletal muscle, and the brain, and are the only other source of energy for the CNS other than glucose.
You may think that gluconeogenesis is simply the reversal of glycolysis. However, there are many irreversible reactions that must be bypassed in order to undergo gluconeogenesis. As shown in this diagram, liver and kidney cells make glucose from pyruvate by way of oxaloacetate.
Ketone bodies are a product of ketogenic amino acids and cannot be converted into glucose, but are broken down into acetyl-CoA for ATP production through the citric acid cycle and the electron transport chain. Insulin is a hormone produced by the pancreas that regulates the amount of glucose in the blood. Insulin promotes the absorption of glucose into the cells of the liver and the muscle. As we already know, insulin promotes fat storage in the adipose tissue. And so if we can reduce the insulin levels by following the ketogenic diet, then this is an adequate tool for weight loss. Although the ketogenic diet is a favorable avenue for weight loss in some individuals, it's not necessarily meant for everyone. Although the ketogenic diet decreases your insulin levels, patients with type 1 diabetes should avoid this diet because it can decrease their insulin levels to a dangerous number. Patients who have had a history of eating disorders should also avoid this diet as it can cause them to relapse by being restricted to specific foods and food groups. Patients who have had gallbladder removal surgeries should also avoid this diet because the gallbladder holds bile, which assists in the digestion of fat. And with such a high fat diet, this can lead to them really not feeling well.